What do you want your later life to look like? You might say, it's a long way down. I've not really thought about it. And you wouldn't be alone in that sentiment. Many people don't think about aging until they need to. I know when I was young, I didn't give aging a second thought. But perspective's a funny thing. I'm older today than I was last week. The closer to old age I get, the clearer it becomes. Unfortunately, the older I get, the worse my eyesight becomes. Maybe that's one of the reasons people don't really think about aging until they walk right into it. I started my business because when my family needed a reliable home care service, we really struggled. What we found was impersonal. A disconnected series of interactions focusing on the wrong things, delivered by an ever-changing group of strangers. I wanted my business to be different, to be relationship-led, to allow for real connections, to give people a choice of who they invited into their lives. I can tell you from personal experience, if there are two people in a bathroom and one of them's naked, it's a little bit awkward if you don't know each other. I had a vision of home care where caregiver and client know each other so well that they're able to laugh together at the absurdity of life. The problem is, we have an issue. We all have an issue. Population dynamics or generational cohorts is creating a ticking time bomb in the US and also the UK. A combination of increased life expectancy and declining birth rates creates a challenging future for our elders. We have a population bubble, the baby boomer generation, reaching a point in life where they need some care and support. Unfortunately for us, the issue is the baby boom was exactly that, a population explosion. The declining birth rates in the two following generations mean that my generation is smaller than that of my mother. The generation of most of the people who work with me, sadly, is smaller again. This means that our healthcare systems, whether insurance-backed or publicly funded, now have a large number of people drawing on them and relatively few people paying in to fund it. It means the large numbers of mums and dads that need care and support have got a smaller number of sons and daughters to provide that support. Oh, and the bad news doesn't end there. It also means that the workforce that all of the people within society is drawn from is also smaller, meaning there is competitive jobs markets in many parts of the economy, but especially when it comes to finding the beautiful human beings who are capable of caring for another. So before this turns into a dystopian nightmare, what can we do about it? Well, the tech industry would tell us that the future is technology, that robot caregivers and AI-based solutions can solve our problems. And then politicians, like our former Prime Minister in the UK, might suggest that AI can care for the elderly and solve our workforce crisis. In the UK right now, we have 111,000 empty adult social care jobs. The problem is that I think in this situation, tech and AI comes from the wrong place. It's tech being trumpeted because it's politically or financially expedient, not because it delivers a benefit. The longest study of the human condition in the world is the Harvard Study for Adult Development. Since 1938, the study has followed a total of now 2,000 people across 3 generations. And the findings are that there are 2 key contributors to well-being. The first is taking care of our physical health. The second is the number and strength of connections to the people in our lives. The warmth of the connections to the other human beings in our world has the potential to increase our happiness, our physical health, and even our life expectancy. This is unfortunately where the tech argument falls at the first hurdle. If it is tech to remove relationships, it has the potential to limit or reduce the very interactions that the Harvard study says are so important to our well-being. By definition, the artificial bit of intelligence is just that, artificial. What we need is real people. AI is problematic in another way, and it's the I that I would like us to focus upon. Inevitably, the I that is considered is IQ. OpenAI, Google, and Meta have a stated goal of creating artificial general intelligence, or AGI. Put simply, that is computation as measured against human IQ, or cognitive ability. As a society, we celebrate IQ. Now, we need to be careful at this point because this is, after all, an ASU event. But our seats of learning, the testing that we use, and even the recognition that people gain within society is based on IQ. In April 2025, OpenAI's large language model O3 scored 136 on a Mensa IQ test. The fact that we all know what a Mensa test is proves that we venerate IQ. Why is that a problem, you might ask? Well, a Berkeley University study, which began in the 1980s, has provided data for over 40 years on the traits within humans which drive success. The research was conceived with the goal of tracking the factors which professional and personal development are driven by. The results show that high IQ is not as important as high EQ, or emotional intelligence. In actual fact, the results show that high EQ, or emotional intelligence, is 400% more predictive of future success. Why are we so obsessed with AI? In that situation, forget AI. What about AEI? So what is AEI? Well, AEI, or augmented emotional intelligence, is the use of AI and technology to improve emotional connection and assist people in being more people-y. If EQ, as defined by Daniel Goleman, is the ability to recognize, understand, and manage our own emotions in order to better connect with others, surely the focus should be on EQ, not IQ, and as a result, AEI, not AI. If the key to success in life, according to the Berkeley study, is high EQ, and the key to happiness, as per the Harvard study, is human relationships and connections, surely we should be using technology to increase human contact, not to replace it. If a home care worker is able to complete essential notes from a visit with a client using an ambient scribe, the admin time saved can be used for more human contact. If the process of producing a client plan of care is automated using AI, the efficiency can ensure that the care manager is better able to understand the client's character and build better rapport. If smart monitoring of caregivers' stress levels and emotional state ensures that they are better able to support their clients, that is tech improving human interactions. If AI is used with people living with dementia to build relationships more quickly and create a connection for caregivers with feelings in the client's amygdala, which are more resilient to the dementia, that is AEI. So our workforce crisis in the UK shouldn't be viewed as something that AI can fix. I truly do not think that it can. I do, however, see huge potential for AEI to allow better connections with the clients who we serve. I also see a bright future for our care professional workforce with AEI allowing them to succeed, supported by tech to enable them to maximize their emotional intelligence and deliver the awesome care that our elders deserve. We need to better value emotional intelligence. The architects of our digital future are remarkable, high IQ people. The risk is, as high IQ people, that the tech industry creates the future in their own likeness. I would ask that we pause and say, is that really what we want? Imagine a future where our happiness and that of our seniors is improved by tech, which supports human interactions rather than seeking to replace them. All my grandmother wanted from her care was for the experience to be more relational, more human. more caring. As a carer-centric care provider, my business honors that sentiment every day. By looking after our caregivers, we make sure that our workforce is better placed to care for our elderly. We need technology and public policy which helps people to be more people-y. After all, how can we hope to care for others without connection, emotional intelligence, and love? Thank you.